I am Dr. Surajit Rai Chaudhary. I've completed my master degree in psychiatry from the Bangabandhu Sheikh Mujib Medical University. I have been in this field last 8 to 10 years. So one of the health surveys going on under the National Institute of Mental Health Bangladesh. So before we have some study, overall the prevalence rate of any psychiatric illness in Bangladesh is 18.3%. Among them, actually most of them are depression. So it would be maybe the 10% to 12% are suffering from this disorder. We call it major depressive disorder, not depressions. Okay? If the diagnostic criteria are fulfilled or met in case of any patients, we diagnose it as a major depressive disorder. So major depressive disorder is highly prevalent and the lifetime prevalence rate is more than 70%.
So my next question is, why is it hard for someone to seek help in Bangladesh?
One of the hardest things, because in our Bangladesh, to talk about some mental diseases or mental issues, it is so stigmatized that people usually isolate them. People usually bully them if they know that this person or that person are taking help from the psychiatric services. Usually they bullied by their peers. One of the reason is this is a stigma. Another is available resource is very scarce in our country. As you know, that health expenditure among in our Bangladesh, almost 99%, 99.5% are spent for the physical illness. Only 0.44% are spent for only mental illness. Due to this reason, we have a lack of facilities, we have lack of manpower to deal with these issues, especially in the mental health services. Not only psychiatrists, you have also mental health worker, psychotherapist, as well as some psychologist. This unless we increases our manpower, this is very hard in our country to seek help from mental health services.
Right. Okay. So my third question is, what does the government has to say about this issue?
Okay, this is a very good question. I think it is a very time-demanded questions that what the governments are doing in their issues, in that regards. Actually, last 5 to 8 years, governments come forward to address these issues and give so many incentives regarding in this field. Whenever they think about that we need to expand our mental health services, government took the initiatives that in every Upazila health complexes, the medical officers should be trained in a mental health. The training is going on under the Mental Health Institute of Bangladesh. So I think the future is bright. As the doctors who are at that Upazila health level, village level, if they know that mental health issues and how to diagnose it and primarily how to treat it, I think most of the populations get services from their Upazila health complexes.
So my next question is, can depression be cured and how?
How? Okay. depression itself is a episodic. It's a self-limiting disease. But when it in a mild and moderate form, you can go for psychotherapy for depressions. The best way of psychotherapy for the depression is cognitive behavior therapy, which is our evidence-based treatment and have been cited Western world as well as in our country, and it is evidence-based. Another thing, when it is depression is moderate to severe enough, we usually prescribe some antidepressant, and along with this psychotherapy that is called cognitive behavior therapy. If we continue this treatment for the 9 months and the psychotherapy is completed, then depression will be cured. But in our country, patients usually don't comply for that period of treatment. So that episode depression will recur again and again, as if they think that depression will never cure. But depression is a cure-related disease.
What has the society has to say about it?
As a psychiatrist or as a mental health worker, we know that for the well-being of our patient, we not only require only treatment, but support from family and support from community is essential for the better prognosis, for the better outcome. But if the society or family does not know about how to deal with these mental issues, then the patients will not progress good. For that reason, I think the mental health services should include community health services as well as some family educations. I think the services are nowadays is day by day increasing in our society, and I think the within coming years, the big in all over the big city in our Bangladesh, we can provide this sort of services for the community health services as well as the family education.
So what is the future of this issue in Bangladesh?
Actually, according to the World Health Organization, they predicted that depression will be the leading cause of disability. So Bangladesh, as being a is going to be developing country, and we will fulfill the MDG plan. We will achieve it also. So Bangladesh, the overall scenario is good because before 8 to 10 years, the psychiatrists will be scarce, very few, and the psychiatric hospitals are very few in numbers. So as we are progress to the developing country. So Bangladesh scenario is a good that the psychiatrists are gaining emphasis in our society nowadays, and the families members are getting aware day by day. They know that it is a brain disorder, so they seek help from us. That is the good way to deal with these mental issues. So I hope our futures and our scenario is better than so many countries than Western world or other than developing country.
Why do you think the people who are depressed choose suicide as the best option?
Okay, very good questions, because 90% of the completed suicide patients have been suffering from the major depressive disorder. Because the three cardinal features of depression is hopelessness, helplessness, and worthlessness. When the depression is severe enough, actually our brain created some frustration so severe that they find difficult to cope up with that. For that reason, as I already inform you that it is a very hopelessness, helplessness, worthlessness so severe, they think that it is the only solutions. but it is not the solutions. I am telling you through your research project that if you have some suicidal thoughts or idea, please immediately take help from the psychiatrist.